PowerPoint outlines an electronic health record implementation plan for Hoya Hospital using Microsoft Project as a tool for implementing this type of program. Hoya Hospital is a 565-bed training hospital. Given its large capacity, it wishes to improve its efficiency. To accomplish this task, Hoya Hospital has decided to implement an electronic health record system. Therefore, the mission of this project is to successfully implement an electronic health record system at Hoya Hospital. They wish to complete this project by spring of 2010. To be able to accomplish this goal, the project is planned to begin on March 16th of this year. It is estimated that the project will take 238 days, so the project can be completed by February 10th, 2010. The hospital also hopes to complete this project under budget while achieving the highest technological advancements. Microsoft Project will be used to accurately determine the number of days that the project will take. To better understand the project as a whole, the project is broken down into different tasks, known as the work breakdown. There are 7 tasks involved to successfully implement an electronic health record system into Hoya Hospital. These include patient information management, laboratory, pharmacy, radiology, imaging, nutrition and food service, and clinical information system. Each task takes a certain amount of time. Patient information management is the first task that needs to be implemented, or else other systems cannot be implemented. Once patient information management is configured, laboratory, radiology, and nutrition and food service tasks can be implemented. The implementation of these tasks can begin as soon as the configuration of the patient information management is finished. It is important to note that implementation can begin while training is taking place for patient information management, as long as the configuration is complete for patient information management. This is true for any other task. Implementation can begin once the configuration of any preceding task is done, regardless of the training. Once radiology is configured, implementation of imaging can begin, and once laboratory configuration is complete, implementation for pharmacy can begin. Only after all the previous tasks have been configured can the clinical information system be implemented. This task is considered a high-level task because it involves all the tasks to be completed before it can be implemented. It is also the longest task for configuration and training, consisting of 119 days. The duration of each task and the start and finish of each task can be found on the table shown. Each task can further be broken down into subtasks. The first task, Patient Information Management, has 4 subtasks: Enterprise Master Patient Index, Patient Registration, Patient Scheduling, and Admission, Discharge, and Transfer. The whole task takes 41 days. The first subtask, Configuring the Enterprise Master Patient Index, takes 3 days. The configuration must be complete before any of the other subtasks begins. After the configuration of patient registration is complete, the last 2 subtasks can be started. Note that the training for Enterprise Master Patient Index does not need to be completed to start the configuration of the patient registration. This is true for the other subtasks. Laboratory implementation takes 35 days and includes the subtasks of chemistry, microbiology, and anatomic pathology. Pharmacy implementation takes 58 days and includes the subtasks of in- and output patient pharmacy, electronic medication administration record, barcode medication administration, and adverse reaction tracking. The chart shows which configurations need to be completed before starting the other tasks. Radiology takes 35 days and consists of general and nuclear radiology. Imaging takes 11 days, and subtasks include clinical image viewer and document imaging. Nutrition and food service implementation takes 11 days, and it has the subtasks of food service management and clinical nutrition. Once all the previous tasks have been completed, implementation of the clinical information system can begin. It takes a total of 119 days to complete. Its subtasks include clinical rules engine, intake, output, patient education, order management, vitals and measurement, results reporting, clinical documentation, computerized provider order entry, clinical alerts and reminders, and consults tracking. There are several lessons that we can learn from this project regarding Microsoft Project. First, it was shown that Microsoft Project is a valuable tool for project planning, including implementation of an electronic health record system. Using Microsoft Project as a tool, it is easier to estimate the duration of a project. We also have the ability to view the project timeline. Lastly, using Microsoft Project as a tool, it is easy to reforecast in order to reflect on changes to the timeline.